Dental Fuel, the podcast that focuses on what no one else is talking about. Mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in-between. Dental Fuel is brought to you by Doctors Disability Specialists, a team dedicated to helping dentists and physicians with disability insurance, life insurance, and comprehensive business planning. Our next guest on Dental Fuel is Dr. Shannon Johnson. Shannon Johnson grew up in a small coal mining town in eastern Kentucky. She graduated from the University of Louisville School of Dentistry in 2002 and completed her AGD at University of Florida in St. Petersburg in 2003. Ever passionate about providing the very best care for her patients, Dr. Johnson is an avid continuous learner, attending countless hours of continuing education each year from the profession's best and brightest. An educator at heart, Dr. Johnson has taught at both the University of Florida and the University of Louisville. She is an associate faculty member at the Dawson Academy, where Dr. Johnson dedicates time to helping dentists around the world master the skills to predictably restore simple to complex cases. She is currently the president of the Dawson Association for Complete Dentistry and leads 2 Dawson Academy Study Clubs. In her free time, Dr. Johnson enjoys spending time with her husband and daughter playing board games, visiting theme parks, attending various comic conventions, crafting, and scuba diving. Shannon Johnson, welcome to Dental Fuel. How are you doing today?
I'm doing fabulous. Thanks for having me.
I'm so happy to see you. I know the last time we spoke was via a Instagram Live. Now we are in the flesh at our Ignite DDS.
Okay.
In the flesh.
Ignite
DDS retreat. I'm so happy to see you. How are you enjoying our retreat so far?
Oh, the energy is great. It's been fabulous to brainstorm with like all these energetic, creative minds. So, I count myself as a very fortunate soul to be here.
Oh, well, we feel fortunate to have you in our company as well, too. Shannon, I would love if you would share with our listeners a little bit about yourself.
All right. So Shannon Johnson from Kentucky, Louisville, to be appropriately the right city. Anyway, a little bit about me. I graduated from dental school a little over 20 years ago. And in that time frame, after I graduated from school, I did a 1-year postgraduate training program down in Florida, AEGD program. And then I stayed and taught at that program for several years before I went into private practice, had a small fee-for-service practice in Florida, until I had to relocate back to Kentucky for some family reasons. And then I've been back in Kentucky, and I've taught at the University of Louisville, and I'm back in private practice now.
Can you tell us a little bit about your private practice?
So my practice is very interesting and unique. I office share space with an older doctor. I use one operatory that I basically rent from him, and I started it from scratch right at the pandemic. So it's been, really interesting to watch that grow to a couple hundred patients, and it's just me. So
cool.
Quite fascinating little practice, but
definitely a different setup.
Yeah,
one chair.
I know. It's so interesting. Yeah. That's the beautiful thing about dentistry. You can do it
how you want it.
However you want.
Practice how you want.
Yeah. If you can dream it, you can make it.
I would love if you would also share about your journey with Dawson, and you are a faculty member for them. Is that correct?
That is correct. So back in dental school, I had a couple patients who really got me thinking that there had to be a better way. So one of the first patients was a 5-unit bridge that I was doing in my 3rd year of school. And my faculty member said, it's not going to last. And I'm like, well, why wouldn't it last? Why am I going to do a 5-unit bridge, which was wisdom tooth to premolar? Like, why isn't gonna last? Why would I do it? And so anyway, that got me thinking, and that got me searching. That's how I stumbled upon to Pete Dawson, Concepts of Complete Dentistry, in his book. And so I'm like, okay, well, that's kind of cool. Well, then fast forward to my senior year, I encounter a denture patient that I had to see over 20 times in dental school. Like 20 times. I made multiple dentures with every faculty member, pros faculty, and I'm like, all right, I'm getting ready to graduate dental school, and I don't want to practice like that. I need something predictable. And it just so happened that the residency program was associated with the Dawson Academy, and I learned about them. So I'm like, I want to go down to the beach for a little bit. So I was fortunate enough to be accepted into that program, and then over time, I established a relationship with the academy. So that's how I have been there. So predictability.
Yes. How, in addition to predictability, how did the Dawson Academy transform the way that you practice?
My favorite thing is that Pete Dawson would ask the question, who deserves an incomplete exam? And if you look at that honestly and ethically, you realize every patient deserves the best, to know what's going on and to be able to have like maintainably beautiful, healthy mouth, whatever that might look like for that patient, their economic level, that sort of thing. And so I was able to learn how to really connect with patients, no matter the practice setting, and provide care at an elevated level, meeting these requirements for like functional stability, aesthetic stability, and again, that the patient can maintain it. And so I find that those principles are timeless and they apply pretty much in any practice. And I've practiced a lot of different ways, so I get quite passionate about it.
Very cool. Now, if a person can't go out to Dawson, say it's a new dentist coming out of school, really wants to start learning more, up their CE game, what would your recommendation be for them?
So I think you have to really look at yourself, see where the return on investment is going to be initially. Like, what do I need to learn first? And then I think you have to seek out the highest quality that you can pay for. So depending on where you are regionally, there are like so many amazing like CE centers and a lot of really great state meetings or like regional meetings that you can attend and hear speakers. So you can go hear Dawson, some Spear faculty, Pankey faculty at some of those meetings and really challenge yourself, but focus in on building a strong foundation of occlusal principles and then just start diving in. If you want to do aesthetics, make sure that you have a strong understanding of materials and then start there. And then, of course, as a bias, because, we're on a podcast, we might want to talk a little bit about...
Who's that? Huh.
Ignite.
That's
because,
right.
Oh
yes.
my God, come on. So affordable.
What a natural plug. I wasn't going in that direction.
But honestly, so here's the thing, Ignite DDS is here to like inspire and help young dentists start to grow and to see what's possible in a very, again, ethical way. So great content. Reach out to everything that you can that's free. Find a mentor. It doesn't always have to cost an arm and a leg to be able to access really good quality people. You just have to be passionate and you have to put in some legwork.
How did you get connected with Ignite?
So it was actually through the Academy.
Look at that.
So David came and spoke at a couple of our alumni retreat meetings and things like that. And so then we started to meet and talk. And then he asked, because I was running some other study clubs, if I would be a study club mentor. And I was like, to go hang out with some of the most brilliant young dentists in like the country? Of course I'm going to do that. So that's how it started.
Thank you for your kind words. I don't consider myself that, but I am learning for sure from people like yourself.
We're all on the journey.
That's right. It's the practice of dentistry.
Yeah. Continuous learning.
For our listeners out there, you have so much to learn from Dr. Johnson here. And if you're curious to hear a little bit about what she's teaching, her methodology inspired by Dawson, the study club through Ignite DDS is a great way to get an introduction to what study clubs are, to advancing your techniques and your skill in dentistry, and to learning from brilliant minds like Shannon Johnson, and finding a mentor in them as well too, and somebody that you can throw questions back and forth. Right. So great when you have a case come in and you can shoot a quick question over and get a pretty quick response about a case that you may have in the chair. So that I think that for me that is just worth its weight in gold.
I think it's amazing when you can build a community and you can just say, hey, this is where I'm at. This is where I need help. And it's not a judgmental zone, because we've all been there, right?
Yeah.
I mean, we're all learning. Mm-hmm. We're all continuing to grow, and you don't know what you don't know. But the thing is, if you can learn to ask the questions and you're asking the right people, then you start learning and you can do great things. So, yeah.
100%. Well, Shannon, here at Dental Fuel, we are dedicated to learning from clinicians, team members' mistakes. So I would love if you would share with myself and our listeners a little bit about a clinical mistake that you made, how you learned from it, and how you grew from that.
Yeah, so there have been many. Sadly. We call it research. Glenn DuPont actually calls it research, not a mistake, right? But definitely some learning moments. And I had a case, and this was actually further along in my career, that, she had a lot of wear. She had done dentistry south of the border and had really thick base metal, porcelain fused to metal bridge work, like roundhouse bridges that were shearing and breaking, and it was just a constant issue for her, and it was plaque trap. It was just bad, so it was going to have to get replaced. So I went through all of our checklists at the time, and I was restoring her, but she broke down. She did great through a provisional phase, but then she broke like a canine. It came off, right? And I'm like, my work doesn't really do that very often. Like, what's going on? Like I said, this is later in my career, so we're talking like 13 years out or something. So I'm thinking I should have this pretty well under my belt. What I had missed ultimately was she was a significant airway case. And I had missed the impact that had for her. Because she was constantly moving, clenching, grinding, and she had been diagnosed with sleep apnea. And I made the mistake of just letting that be. Okay, well, you're wearing a CPAP. Let's just move on, right? I checked that box. But I really hadn't checked the box because she really wasn't compliant. It wasn't titrated well for her. And we still had to manage parafunction on top of it. So, the hard part with a failure like that is I lost her anterior guidance. I had to go back and reestablish all of that, manage the parafunction, but really you lose like your patient's confidence. And so that's hard, and it's hard to look back and see. So, I have to be careful because a lot of the mistakes that I'll make, it's because I've jumped in like a checklist. So at the Academy, we have like this checklist, which I love because if you follow it step by step by step, you don't miss things. But you also have to like really think about it. And I think for that one, I just checked a box. And my other mistakes, it's just because I'm like, oh, well, I already know that. I'll skip it. And it ends poorly. So anyway, that was one of the most prominent ones that I could think of that really made me sad.
How did the case end?
We restored her. Then I restored her one more time. So, at that point, I'm paying her for the case.
Yeah, absolutely.
Got her connected to a sleep physician in the area who really helped improve that area. And she has to wear an appliance at night with her CPAP to help control the forces.
Wow.
She didn't have a lot of posterior support. She wasn't an implant candidate, and she refused partials. Right?
Yeah, that's...
So, I was like, you still have to have like...
Something's got to be back there.
You do.
Sure.
So
posterior support's so important.
It is. Otherwise, you can overload. Even if you have everything dialed in, because if there's that parafunction component, crossover component, airway component in this particular case, it was harder, and I'd missed it. So
speaking on clinical stuff and posterior support, I find it so interesting when we see non-carious cervical lesions when people are missing posterior teeth. I mean, all of that load is on those anterior teeth, and I'm just waiting for these teeth to go and like fracture off.
Well, and many start to, right? They start to get like diastemas. They start to flare a little at a time. So if you're not measuring that, you can ask the patient, have you always had that space? But I do feel like as a clinician, if we start to see diastemas, we need to record them. Like the space. That's where intraoral scanners and digital photography that you can take and just hold on to, you really will be able to see if over time that those are getting like bigger. And then fremitus, anything shaking and bouncing. So you just take your fingernails and you put very gently, like a little butterfly on the teeth, and have the patient tap, and grind all around. And you shouldn't feel the teeth moving. And a lot of folks who've lost posterior support and things start to maybe close down, you'll start to find that they're really bumping hard on their front teeth. And all of those things will start to happen. And they can get the non-carious cervical lesions. And then you go in and you're like, I'm going to put this beautiful little filling in. And then what happens to the filling? Boop. Out it comes, right? It's like, did it make it to the parking lot or like the first meal? Not always, right? So then what do? You come back in, well, there wasn't enough retention. So you're like scoring more into the tooth. So you have to learn to control all of those factors. And then, hopefully get them some back teeth as well.
Teeth are tricky. Teeth are tricky.
Such a beautiful system.
It really is. It really is.
I like it.
Well, moving on to a financial mistake. I would love to hear about a financial mistake that you have made in your life that you learned from. Other than going to dental school. Which we all know.
I'm going to actually have to say that when I went to dental school, it was like at a really good time. So I was fortunate on that matter. So I know the amount of debt that everyone's graduating with now is crazy. So staggering compared to like when I went to school. So I really feel that pain. But I think honestly for me, it was not getting disability insurance early on. What I'm finding is that many of my colleagues, the price goes up the older we get, maybe there's enough light here that I won't look quite so old, right?
You don't look
Like,
old.
but
You're not old.
at the same time, you want to lock that in. But I've seen so many young folks start to have problems, back problems, hand problems, wrist problems, neck problems. And that disability insurance really helped them. And I was a little bit late coming to that game. So I would say that was probably the biggest mistake that I feel like I've made financially at that point. And then just not having a good financial planner, one that would jive with me. I had a financial planner. They were too rigid, too square for me and my risk. So I think that relationship, you have to find someone who mirrors what you want, so that way you can exceed. Then on a personal level, I will tell you, whenever I made that transition back from from Florida back to Kentucky, I really felt like I could do it all, right? And so for several years, my mom was terminally ill. My father had cancer at the time. And I was trying to help with the family, but I was still trying to run the practice, and I was flying back and forth every week, right? And I was young. I could do this, right?
We can all do it all when we're young.
I could do that for days and days and days. And what ended up happening is I depleted all my funds. I didn't get help soon enough. And so then whenever I sold my practice, I basically, for lack of a better word, I just gave it away to deal with the headache. And I mean, that's on a very personal level, so we can always talk about those mistakes. But I think profoundly, that was one of the things for me. And had I had it to go back and do over, I would have reached out for help sooner and just had a really good professional help me. Yeah. And maybe say, hey, you got to do this a little different.
For both of those mistakes, did you feel like you didn't know about the resources available at the time?
So that's a good question, because I would say I didn't know. I was that time, 30, 31. So I didn't know, but I also was like, well, I can't afford them. I don't have the time. Like, I kept blowing it off. Like, I don't know. I just felt like it was going to be further in the future. Like, it wasn't something that I was dealing with now. And I've learned that you really just have to set things up for catastrophic type situations, because they do happen. Mm-hmm. Not to be like a Debbie Downer on that aspect, but things can and will happen that can steer you wrong ways. And I didn't grow up in like a financially brilliant type of a family. Like, my dad was a coal miner, kind of like machinist. Like, we didn't have a lot. So it was tough. I wish I would have just gotten help sooner. So yeah, having the right resources, being connected to the right people. Early in your career, finding people that you can connect with, that understand your goals, not their goals for you, right, but your goals, and can help you get there based on where you are now, but what your future self wants to be. So
I will say that I feel like dental schools are doing better as far as bringing information in with regard to disability insurance, right. Potentially dental insurance as well too. Maybe. But financial management, and it's not there. No, it's not there. No. So, buying is huge for those who want to, acquire a practice, start their own, but selling, I'm sure it's its own little thing as well too, or a big thing, really. Yeah. I can only imagine that was a really stressful time for you. Yeah. And you kind of just, I can see that. You kind of just wanted to get to the next thing.
Well, you get to the point where, it was just like, okay, I need to move on. So great for the people who purchased it, kind of a standpoint. But I'm like, had I just had folks to help me with that and look at the big picture, or just really realize who I was and where things were going, a year earlier, totally different ballgame.
I got to ask, would you ever own again?
Absolutely. 100%.
Very cool.
Yeah, no, I think, again, you can practice dentistry any way that you want. And I've practiced it in DSOs, educational settings that I helped out with, federally qualified health centers and things like that. I love public health for folks. There's just a lot of ways to practice. But owning your own, for me, it's just great. I get to treat patients the way I would want to be treated. I take care of them the way that I want to take care of them, and no one can tell me to do that differently. So without fail. Now, would I do it smarter? Oh yeah,
100%. I'm sure.
Yeah. No, you get your team together, and you realize, again, you don't know what you don't know, and you learn to ask for help earlier or seek out things to help balance out deficiencies might be a strong word. But that's how I have deficiencies in some of those things. It's not something I understand well or think about. And I don't enjoy researching it, enough to have a conversation maybe, but, I don't want to spend my whole day thinking about that. So there are other people who that's what they do. Like, they love doing that. And I'm like, great, you love doing what you do. I love doing what I do. So you take care of me, and then I can take care of everybody else.
If you're listening and you feel like you need help with one of these aspects, we can definitely help you. And if we can't, I'm sure Dr. David Rice can find the right person for you. I think that that's one of the great things about our community is that even if we can't help, we'll find a way to help.
Right.
And I think that we're just here to help each other out and help grow individuals and the entire profession as a whole.
Yeah. Elevate, onward and upward, right? Ignite the passion. So I agree.
Yeah. What does your team look like now?
So my team is fascinating because it's me, myself, and I.
Ah, beautiful
Not
team.
always, but, well, there are pros and cons to that, right? So going through the pandemic without having a large team was like huge, right? Great, because I watch all of my friends and colleagues struggling with like hygienists and things like that. Now, I do have an assortment of assistants whenever I'm doing larger cases or need help where, they will come in and help me. But really it is me, myself, and I.
Wow.
Yeah. So then you also start to realize that I hate talking on the phone. So
do you set up all your appointments and everything?
I do everything.
Really?
Literally. So like I tend to do a lot with text, or you can actually online schedule with me and then I'll confirm it, right?
Yeah.
For like new patients and things like that. So it's amazing how that can help. But it's kind of cool because I call all of my patients, right? Like I have a conversation with them. So it's even like a pre-screening. So I get to know them, what their needs are. I can schedule appropriately. I know if it's going to be a limited exam because we have to be problem focused on something. I know if they're going to need a ton of work. I know if they've been regular in their care. And then I'm my own hygienist right now, which is really interesting too, because hygienists are amazing support folks, right? I love my hygienist. And so I'm on my side of my mind thinking, really, a hygienist might even do this better, but patients really connect to the time that they have with me. So then my patient acceptance is like really, really high, and they like it.
That's cool.
Go figure, right?
Yeah. It's a great way to watch a patient's perio status as well.
Oh, it's huge. And I do salivary diagnostics and things like that, and use adjunct therapies to help. And so I have a lot of folks who came to me with significant perio that we've stabilized. So teeth that other folks are like, yeah, these need to go.
Let's get them out.
And I'm like, do we really want to do that? I'm not so sure. Placing implants and folks with poor periodontal health, those implants don't last as long.
Right.
And I know we were talking about this on another case that had come through, right? We're us all chatting, and it's kind of like, all right, implants, do they last forever? No, they have a high survival rate, but the success rate is actually considerably less when you start looking at studies. So yeah, you might have an implant in there, but it might be pussy and oozy and and all those like good things. Pussy's not good. But like if you can keep a natural tooth and you can help people get to health, what better, outcome could you have?
You're your own assistant as well?
I am. And some days I'd like to fire myself.
Oh, yeah. I'm the worst assistant.
So I use a dry shield.
Okay.
Which is amazing. Yep. I use rubber dam. Yep. Which is amazing.
I'm a rubber dam fan.
Right? A lot of people don't want to do it or deal with it, but it really it elevates your dentistry. Absolutely. It keeps your patients safer, and you deliver better care. Yeah. So that's a whole nother
I could talk about rubber dam all day.
I love my rubber dams. Me too. And my dry shield
protects the airway, keeps the tongue out of the way. Dry shields are great as well too. But man, that rubber dam, I just hated it in dental school. Did everything I could to not use it.
Right, which is where people leave, and then they're like, "Oh, I can just use cotton rolls in my system."
Exactly. And honestly, I don't know. I wish people would have been more forceful on me in dental school, but now I use it and I love it. Yeah. I don't see myself doing it any other way. My assistants love it as well too.
Well, that's the thing. The procedures go so much more smoothly, and it's just better. So rely on that. It's been really interesting because when you're talking about like operating procedures and becoming more efficient, like I now really understand, like really understand what my assistants have to go through, setting up. And so it's like a lot of thought process has had to go into it. So like my documentation of like your standard operating procedures, clinical operating procedures has definitely improved for the day when I might have more than one chair if I elect to buy the practice that I'm in now when he's ready to sell.
Oh, okay.
Or if I do a scratch start and take my patients that I've built and then, go to a place that I then create. So
I want to circle back on that thought here in a little bit. But when you were in your own practice in Florida, you had a team there.
I did. I had 4 chairs. I had a front office person, 1 hygienist, and 1 dental assistant. So,
what mistakes did you make with your team?
Making sure everybody was on the same page. I think not having a clear vision initially, just kind of stumbling through things. They didn't really know who I was initially. And I did buy my practice younger. And it was a transition where there was no transition. Literally, like we signed the papers, the doctor was gone. I was in the next day. Like we weren't there together at all, ever.
Which
there was
more
no like handoff.
Now. Yeah.
It is. And I mean, that can be good or bad, but the staff really didn't know. So they were told like the day after, or the day that we signed the paper. So like the next day, like here's the new boss. So I think setting up like your vision ahead of time, where you want the practice to be, was huge. And then making sure that the people who were on the team were ready. And that took me a little bit to really establish and define. And I actually took my team out at that point, and we went out to sailing, and I took them to a little island where I had lunch. And we had made these little beads together, and I literally like gave them my vision. I drew a line in the sand, and I said, I need for you to follow me, but if you can't, it's okay. This is where I'm going, and I need you to believe in it, and I need you to support it. And we can separate now, or you can come along this journey with me. And then I just went over there and sat on the other side of the sand and waited for people to come.
Wow.
And they would pick up like the little words that resonated with them, and we created a necklace. And thankfully they came with me.
That's
we had a really great
cool.
time. But I was like, what if none of them come?
You were sitting on the beach by yourself.
Yeah. And it was also interesting because, again, I was younger at that point. So I came in and, folks were like, well, when's the doctor going to come in? And I'm like, I am the doctor. Come on, everybody can relate to that when you're younger.
For sure.
So you had to like get over that part because everybody in the office was much older than me. So yeah, I would say that was probably some of the biggest issues.
What would you do differently if you were to build a team now, or if you are to in the next few years?
Yeah, so I'm really crystal clear on my vision. And I think having everything written down, the expectations of those job positions, and then just creating a culture of, I wouldn't expect them to do anything I wouldn't do for myself. Again, one of my mentors, Glenn DuPont, he said, you set the new standard when you walk by a mistake. So I think you have to be very disciplined in yourself to make sure you don't allow things. Like if you say, yeah, that impression's good enough, new standard, right? Like you don't want to do that. So you have to hold yourself to your vision and your team, but do it in a positive way. So for me, yeah, just having things more clearly defined and then having more discipline within myself, which definitely has improved.
What does the next 5 years look like for the Dr. Shannon Johnson?
To be determined. No, really, I love dentistry, so I really do see my practice evolving into a larger practice. Be that purchasing the office where I'm at, which I think that could be a really good thing, honestly. So we'll see. But having more chairs and doing complete dentistry in a way that I feel like it could be done, right? The way it should be done. So I think that's going to be big. I think I will try to share more of what I've done well and what I've not done well. Yeah. Because I'm pretty much an open book from that standpoint. With others, hoping to inspire them.
Yes.
My daughter is now finished up her sophomore year in college.
Wow.
So in 2 more years,
yeah,
she's either doing a master's program or she's out and about. So yeah, I want to spend a lot of time with my
course.
hubby traveling because we just celebrated our anniversary.
Yes.
So yeah, I want to be able to find that right work balance life. So I want to give back a lot to dentistry because it's my hobby.
Yeah.
And
I
have
can
a good
definitely
time.
see you and your husband out golfing.
Yeah.
Yeah. If you could provide some advice for our listeners, what would be some key advice you'd like them to take home with them?
Key advice for your listeners. Trust yourself. Trust your heart. Listen to your heart. So in that period, whenever I had left my practice in Florida, I kind of like mentally stayed there for a while, and I got into like a woe is me because I loved what I had and what I had established there. And there was no reason that I couldn't have reestablished that, but I didn't listen to myself, and I kept just like putting my own like vision and goal for myself like behind, and I would do other things, and I just felt like I was losing myself. So that would be one thing. And then always just push yourself to learn, to be better tomorrow than you were today. And I think that's the biggest
advice.
thing in personal life and
Yeah.
financial life
No.
and in life in general. Just, listen to yourself, trust yourself, invest in yourself. And tomorrow will be better than
Very
today.
good. Any last thoughts before we log off here?
Y'all are just so lucky to have you here. Like oh my gosh, I love it.
We feel very blessed to have you here, and myself to have connected with you. So
Now, my final parting words, maybe not of wisdom, but I love to challenge the idea of the status quo in dentistry, and I love that you can really truly practice any way that you want. So if you're somewhere where you're not happy, really step back and figure out what you want to be, and then go be it, because you can.
Shannon, thank you so much for your time today. If our listeners would like to connect with you, what's the best way?
Email.
I love it.
ShannonPJohnson@gmail.com. I'm sure you can probably give that to them somehow, some way.
Yeah, we'll write it out.
And then just tell me like that you saw me here. Like, hey, otherwise,
What
I
up,
might like
Shannon?
over. Yeah. Otherwise, I'll be like, do I know you?
Yeah.
But yeah, reach out to me. We can chat more. It'd be good.
Well, thanks again, and thank you all for listening.
Thank you.
We hope that you enjoyed our conversation with Dr. Johnson. Be sure to connect with her on Instagram @SuperSmileyChick and with Ignite DDS @IgniteDDS. You can find me as well at tsmystas.dds. And thank you to our wonderful sponsor, Doctors Disability Specialists. Be sure to subscribe and tune in to our future episodes.